Hi everyone, this is Dr. Cole Handy Jones here with your handy physical therapy tip of the day. What I want to do is a series on balance. This is such a common complaint that I hear from my patients that I want to do a whole 5-part series for you. So we're going to start by doing a few videos that just talk about what balance is, what controls it, why it gets worse when we age. Do some simple exercises, some advanced exercises, and then some specific exercises that you can do if you have vertigo, which is kind of a special niche, so to speak, in the balance world. So I hope you get excited for this and find something that will really help you balance and stay upright and active in your daily life. Today I want to talk about balance. Specifically, I want to explain what systems control balance. I feel like if you can understand better what goes into your balance system, then you can understand better how to fix your balance system. As a physical therapist, I specialize in helping people improve their balance, especially older people. If you're getting older, you've probably noticed that you're starting to fall, stumble, and feel more unsteady more frequently. And this is important that you start working on it now rather than later. I want to talk about the systems that we work with to help improve your balance. The body's balance system is a very intricate and fine system that work together in perfect harmony to allow us to stay upright and do the different movements that we want to do. There's 3 main systems that we look at when addressing balance. The first is the vestibular system, the second the visual system, and the last our somatosensory system. All 3 systems work together to allow us to do all the different activities and things we want to do, from bending over to pick up an item, to walking and looking to the side as we move, to anything you want to do in order to stay upright and function in daily life. The first system that I want to explain a little more is the vestibular system. Now the vestibular system lies in our inner ear. So our outer ear, that's the part of our ear that performs auditory things. That's how we hear. The inner ear, though, is our vestibular system, and that's very important to our balance. This system has 3 semicircular canals. It's a series of tubes filled with fluid. What this fluid does is acts almost like a tiny bubble level in our inner ear. So that level has fluid in it, and when our head moves position, that fluid adjusts and it gives feedback all the way up into our brain, allow our brain to understand how our head and body is moving in space. So if our fluid is lying level like this, when I twist my head to the side, it tilts with it. When I go the other way, it tilts that way. When I turn to the side, it adjusts, and so on and so forth, to allow us to stay upright and move our head as we're moving throughout different positions in daily life. The second system that helps us control balance is our visual system, or our eyes. This one is usually pretty easy for people to understand. If you stand on one leg with your eyes open versus stand on one leg with your eyes closed, it's substantially harder to stay upright. That's because our vision allows us to see where we are in space rather than just feeling where we are in space. So if I can see my surroundings and see what's upright, I can orient myself easier. It's also important to be able to see our terrain or the things around us as we walk and move. I can see if something's going to be unlevel and adjust accordingly, rather than if I couldn't see that and couldn't adjust and have that feedback. So the next system that we want to work with is the visual system. The last system that plays a role in balance, and the one that most people often work on, is called the somatosensory system. So that's kind of a big word, but basically what that means is that we have little tiny sensors or receptors in our skin, joints, and muscles that allow us to feel where our body is in space and react accordingly. So if I can feel my feet underneath me on the ground, I can balance and stay upright easier than if I couldn't feel my feet. If I'm moving a certain way, I can tell where my foot and leg is moving as I'm walking, for example. I often find that my patients who suffer from neuropathy really struggle with balance simply because their somatosensory system is really struggling at the moment. This is often the system that people work on the most, which is very important, but it's also important to work on the other 2 systems as well to improve your balance. So those are the 3 systems that help us control and regulate our balance. I hope you learned something new today. I'm going to continue doing more and more videos on balance and what you can do to work on that. If you found something helpful in this video, please give it a thumbs up and subscribe, and I'd love to see you back for the next video. Thanks so much.